It's Dr. McAuliff here, and I just want to talk to you about vasectomy. The advantage to having a vasectomy with me, the way I do it, is it's just less invasive. The traditional way of doing a vasectomy are you'd actually have two cuts. When you go home, what you would notice, the traditional approach is you'd actually have two pretty good size, half-inch to inch incisions on each side of the scrotum where the testicles are, and you'd have a bunch of stitches. And it just, as you can imagine, it takes a lot longer time to heal. It's more uncomfortable. With my approach, there's only one opening, and it's about that big, about the size of a Tic Tac, and I do both sides through that single opening. I don't even use a scalpel, actually, believe it or not. It's not a magic wand. I wish it were that easy, but it's actually just I poke a tiny hole and then just make widen the area just a little bit. That way I can access the tube or the vas on each side. The great thing about that is when you go home, I just put a Band-Aid over the area. It naturally heals over in about a week on its own. You'll never see any stitches. There are no stitches to remove. The other advantage is traditionally we anesthetize or do the numbing with a big sharp needle. And obviously, most of us don't like needles, especially in that area of the body. And so there's a newer device. I hover it over the skin and numbs or anesthetizes the vas. That way we can avoid using a needle in the really sensitive areas of the body. So the bottom line with the way I do the vasectomy is it's a tiny hole, no stitches, healed up in 1 week, and you're done.